obviously you're here because either you've had problems communicating with your doctor, or you'd like to communicate with your doctor better, or maybe you'd like your doctor to communicate with you better, which I think is really a big part of the issue. So the way I see it as a physician, but also as a patient, because remember, every doctor is also a patient, is that there are a lot of barriers to communication, because that's really what we're talking about. We're not talking about the doctor talking to you or you just talking to the doctor. We're talking about the whole communication process. Because when you're with your doctor, it should be a dialogue, it should be a partnership, it shouldn't just be a one-way thing. So I see three main areas of potential blockage to communication. The first, I think, even starts before you come in and see the doctor. It's while you're actually making your appointment, dealing with the front desk. And the issues there are that I think very often, particularly with all the changes in healthcare today, that a patient's perception of what the whole process is going to be is not what it was 10 or 15 or 20 or even 5 years ago. So the first step in all of that communication is, firstly, and it may sound really silly, is make sure you actually can see that doctor. Make sure your insurance is up to date. Make sure it's valid. That front desk person asks for your insurance card when you check in, not to be nosy, but because the doctor's office doesn't want you getting a bill. And if your insurance isn't accepted by that doctor, you will get charged for it. So I think that's number one. If you fail there, then everything else is irrelevant. When you schedule your appointment, the receptionist is going to ask, what do you want to see the doctor for? She's not being nosy. She's trying to get a sense of how much time should I schedule for you as a patient. You know, if you're coming in for a bladder infection, you're going to get less time scheduled than if you tell the receptionist, well, actually, I have a lot of issues I need to discuss with the doctor. You don't have to be specific. You know, you don't have to say, my dog died, my husband just left me, and, you know, my daughter's decided she's, you know, I don't know, going to move out of the country. You know, just so that they get a sense of how much time, because that really makes a difference to how that interaction in the exam room goes. One of the other, or a couple of the other big system changes that I think we've seen over the last few years are the requirements of insurance companies, and that includes Medicare and Medicaid for any who are on Medicaid, in terms of what we as physicians or as providers need to get from you in the exam room. So you'll often be asked a lot of questions that you'll think, this has nothing to do with the fact that I have headaches. You know, we'll be asking, when was your last colonoscopy? When was this? When was that? What medications are you on? What other specialists have you seen? Now, part of that's because it helps us take better care of you, but a lot of it is also because we're required to do that. Otherwise, we don't get paid. And if we don't get paid, then there's no money to pay the staff. And then if there's no money to pay the staff, then there's no doctor's office for you to come and visit. You know, so that sort of thing all affects our interaction. The other big change that I've seen over the 20-odd years that I've been in primary care is that when I graduated and first went out into family practice, the doctor was the person you saw. You know, a medical assistant or a nurse may bring you back, may do your temperature, blood pressure. They may say, hello, how are you today? And that's really about it. Now, depending on which office you go to and how they run it, there's very much a team, what's called a team-based approach. So you may find that that person who calls you back does all those things, but also says, what are you here to see the doctor about today? And you say, well, I have a bladder infection. And they may even say, how long have you had it for? What symptoms do you have? What have you taken for it? All the things that a doctor used to ask. Now, as a patient, I will tell you, I hate that. I want to share my symptoms with the doctor and the doctor only. But if your doctor's office is set up in that way, you really need to answer those questions with that person, because otherwise when the doctor comes in, they're going to look at what was already asked. And again, depending on your provider, they may not ask you those questions. So the things that you need to get across may never get across. So think of it not as that medical assistant or nurse as being nosy, but as them just gathering all that information for you. And don't be afraid to share it, because they are part of that healthcare team. Now, You may not want to share it. And that's actually perfectly okay, but you have to be honest about it. Don't not answer a question or give a very brief response because you don't want to share, because that will be taken as your actual answer. You know, if you come in saying, I have a bladder infection, and the nurse says, have you had burning? And you say, no. You know, whereas in fact what you've had is pain and pressure, and it's been going on for months and months and months. You know, the doctor's going to come in and think, oh, you don't have any burning or anything, fine, go away. What you have to say is, I'm not comfortable discussing my problem with you, I want to just speak to the doctor about it. You've got to be your own advocate, and that's a real shame, but it's the nature of healthcare today. So that's sort of the system stuff. Then there's the doctor stuff, okay? Doctors think we're perfect. I mean, let's face it, we are. I mean, obviously we're not, nobody is. We also forget that when we're in the exam room, there's a power relationship going on. And very often we don't recognize it. And patients sometimes don't recognize it. But it is normal to be intimidated when you walk into a doctor's office. I get intimidated if I walk into my attorney's office because I don't know what they're going to do. I am terrified if I go to the dentist because I have no idea what a dentist is doing inside my mouth. That power, and you know, and that power shift very often makes us reluctant to ask questions, to be assertive. So remember that, and remember that the doctor doesn't mean to intimidate you. It's the nature of the game. So that's number one, that's the first doctor block. The second doctor block is that if you look at the statistics, when a patient starts answering a question, doctors on average interrupt 20 seconds after the patient starts. That's not very much time. So that says two things. Firstly, it means when you start talking as a patient, try to get to the point of why you're there immediately, because that will stop the doctor interrupting. But secondly, if the doctor does interrupt, say, excuse me, I haven't finished yet. It's okay. It is your visit. You're paying the copay. The doctor wouldn't have a job if you weren't there. It is okay to politely interrupt the doctor, because most doctors don't realize they're doing it. Male doctors on average interrupt far more frequently and far sooner than female doctors do. This is the statistics, but I'm seeing a lot of head nodding. The other interesting thing is that doctors are more likely to interrupt a female patient than they are to interrupt a male patient. Anybody have any thoughts as to why that might be?
The way of the world.
The way of the world, okay. Well, I think some of it is men are less likely to be intimidated. I think as women, even the most assertive of us tend to be a little more passive in those sorts of power situations. But also, you know, and this is speaking from the doctor's perspective, men are more likely to go straight to the point of why they're there. Women are more likely to tell a story around it, which is okay, but again, you've got to get that doctor's attention. The other issue with getting doctors' attention at appointments these days is computers in the exam room. How many of you see a physician who has a computer? Anybody not? Okay. How do you feel about it? Okay, what don't you like about it?
You don't make eye contact with the physician.
Everybody agree?
I don't like it because in the chart they were more likely to flip back and see things, and in that computer they don't do that.
Okay.
They're not looking at previous stuff. It's stuff.
Have you ever asked your doctor about that? And what have they said? Or he or she?
Whenever I address
Right.
it, then he goes back and looks further, because I'll say it's in there and he'll go back and look.
Interesting, because a well set up electronic chart, everything will be on the screen as a face page, provided your doctor documents things when they come in. The system, I have just started working full-time at Student Health at Elon University, but up until a week and a half ago, I worked at one of the Alamance Regional practices. And the system that we have You know, when somebody's mammogram comes in, you know, I can put that data in. So that's on that front sheet. So when I see a patient in the exam room with the electronic chart, it's all on that sheet. So that's the sort of thing you can talk to your doctor about. You don't have to say, you know, flick back. You can always say, well, is there a way that you can record it easily or something like that? Because it actually should be better from that point of view than the paper chart. But that goes to the doctor's organization. An organized doctor with a patient chart would have had a front sheet that had everything on that front sheet and wouldn't have had to have flipped through the chart anyway.
Lab work that was done 3, 4, 6 months ago, it's there for him to look at.
If I look at, in the system used by the Alamance Regional Practices, because we all, at the moment, I believe, use Allscripts Pro, it's on that front sheet, it's down in the bottom right-hand corner, the date and the lab, and you just click on it, and that'll pull that up. And he or she can print that copy out for you right then and there. You know, so ask the questions. The lack of eye contact. I will tell you that worries physicians as much as it does patients. It is a major concern. It's been one of the major blockages to doctors actually adopting electronic records. And that's going to be a learning process for all of us. If your doctor never gets better at it, you can say, excuse me, could you look at me instead of the computer? It's okay to say that. Now, you're probably going to get a sort of jump back. But, you know, we're human. We don't recognize sometimes how much time we're staring at the computer. So remind us. But there's the other big doctor blockage to communication that I see is the lack of time. How long do you think the average appointment is scheduled?
10 minutes.
10 or 15 minutes, exactly. Okay. Now, okay, so doctor starts maybe at 8 a.m. in the morning. That 8 o'clock patient's 5 minutes late. So already you're behind, okay? So, you know, you're rushing to get through that patient to see the next patient on time. You don't make it. So you're backed up all morning. And we hate being behind, believe it or not. I know we keep you all waiting all the time, but we actually hate running late. And that, unfortunately, sometimes comes across in the encounter. But the other aspect of that goes back to when you schedule your appointment, be honest with the receptionist about how much time you might need. Because if you have a lot of things to discuss and your doctor only has a 10-minute or 15-minute appointment with you, there's not a lot that you're going to be able to get across in that time and actually have a dialogue about. And there's nothing worse. As a physician, you hate leaving the exam room knowing you haven't answered the patient's questions. And I know that may sound crazy because I'm sure you've all had doctors leave the exam room and you've felt, hold on, they didn't do anything I wanted. But the doctor feels that guilt as well.
Well, I wish we would know it.
Exactly, but this is why I'm here, okay? Because, yeah.
Are you sure they all do?
All? Absolutely not. Just as I would say that not all patients really care whether they come on time to an appointment or not. Yeah.
It doesn't seem to be hard for them to get out of the room and run down the hall.
And, you know, I agree. I think specialists are worse than primary care doctors. I mean, just in general. I think a lot of it goes back to the system, which is, you know, if the doctor sees his or her role as merely reviewing what the nursing staff have done, making sure you're doing a brief exam and then leaving everything else up to the nursing staff, yes, you may only see the doctor for 5 minutes. And some doctors you can't train. But a lot of this is about training your doctor.
But don't you think it's wise, before you go, to list all your medicines?
Oh, I have a whole section on what patients can do to train your doctor.
Write those questions down
Exactly.
and leave them with them.
Yes. Well, and that actually brings me, you're perfect, brings me straight into my next section, which is what you can do to train your doctor. Because, I mean, what I've talked about there are the barriers. Now we're going to get to how can you get your doctor to give you what you need from that encounter. Okay? So the first thing is Can you hear me, or am I still too quiet? Okay. The first thing, again, goes back to make sure you schedule the appropriate appointment. For, again, with the amount of time you think you might need if you have a lot of issues. But the other thing is, if you schedule a physical, make sure your insurance covers a physical. Now, how many people in this room are on Medicare? Okay. How many people on Medicare think Medicare covers a physical? It does not. Medicare covers a wellness exam.
Well, that's what
And that's not a physical.
No, that's what I
Okay.
did.
Right, but I mean that's a very important point, because a wellness exam does not necessarily entail any actual physical examination of the patient by the doctor. The requirements of a Medicare wellness exam are basically a review of your health, your immunizations, your medications, making sure you're being taken care of. It's not a physical. That's Medicare rule. Now, we will fudge it, I will tell you that. There's a line in it that says, and any physical exam deemed necessary by the physician. Okay? So most physicians will do a physical as part of it, but it's not a physical. So if you have a new doctor, you may not have that physical exam. Know what you're scheduling your appointment for. Know what your insurance covers. Even if you have private insurance, they will all cover a physical, because that's mandated these days by healthcare law. But they won't cover they won't cover for free a problem that arises during that physical. So if you have a bladder infection, problem with headaches, whatever, don't schedule a physical and want those things addressed at the physical to get it for your free copay, because you won't. Your insurance will deem all of that an office visit. I know it sounds like a lot, but healthcare is becoming more and more complex, and these are the things that do cause problems at office visits, because you come in for a physical and you say, I want to talk about such and such, and your doctor will either say, no, you have to schedule another appointment for it, or, yes, I can address that, but you have to know you're going to have a copay for that visit. That's a bit of a shock if you're not expecting that. That's a conversation I've had in my exam room many times, because it changes all the time. But getting back to other things that patients can do, make a list. The single most important thing you can do as a patient is make a list of what your concerns are, what your questions are, before you come to the office visit. That does a couple of things. Firstly, it helps you as the patient focus yourself on what you actually want addressed at this office visit. Because that is one of the things that messes up appointments. If you as the patient really aren't sure why you're there, well, I need my prescriptions refilled, and I had a headache last week, and halfway through the appointment you remember something else. All of that delays the visit, rushes the visit, because the doctor's trying to cram it into that 15 minutes. If you make a list ahead of time, you know what you want addressed, and you can make sure at the end of that visit that all those questions have been answered. There's nothing worse than the doctor leaving the room, and as you're checking out to the receptionist, you think, oh, I meant to ask such and such. Well, it's too late then, because the doctor's already in with another patient, and you're in the position of having to schedule another appointment. It's much better to have that list with you and address those things in the visit. The second important thing is to write down the answers to your questions, unless they're really obvious. Particularly if the doctor's saying, well, it could be this or this, I'm going to send you for this test. Write that down. If the doctor says, I'm going to send you for a test, why? Why is always a really good question to ask your doctor. And if the doctor says, well, I just think you need it, that's not an answer. Okay? The answer to why should be because it will rule this out, or it will rule this in, or it will enable me to give you the best treatment for this. Okay? Don't let your doctors off the hook. Ask why. And also ask why not. You know, if you are there for a physical and you want your headaches addressed and the doctor says no, why not? Make them explain why not. If you say, I think I need a colonoscopy, for example, and the doctor says, oh, I don't think you need that. There's no history in your family. And I say that because I've had patients tell me other doctors have told them that. You can say to them, why not? I know I need that. It's okay to question your doctor. The other thing that I find, and there's really two sides of the same thing, that are a real difficulty with communication is when patients are either not honest with the doctor, and that's not lying, but there's a tendency, and it goes back to that power situation. When we're a patient, and this goes for doctors as well, we tend to want to give the answer that we think the person wants to hear. Are you taking your medicines every day? You go in for your blood pressure check, say, and your blood pressure's up a little bit. Are you taking your medicines every day? Oh, yes. Well, if you actually only take them every other day because they're too expensive for you to afford to buy and take every day, you need to tell the doctor that. If you're only taking it every now and then because if you take it every day you feel dizzy and lightheaded, you've got to tell the doctor that. Because the doctor's not going to know if you don't tell them. We don't take offense if you don't take things the way we prescribe it. It does upset us if you're not taking things and you tell us something different so we can't help you. You know, if you come in and your blood pressure is 162 on 90, when it should be below 140 on 85, and you tell me you're taking your medication exactly as I've prescribed it, I'm going to want to increase your medication. And that's going to cause you problems. So be honest. And the other thing is the embarrassment aspect. It's embarrassing to talk about urinary incontinence. It's embarrassing to talk about vaginal dryness. It's embarrassing to talk about leakage from the bowels. But those are things that your doctor can help you with. Don't be embarrassed. It's embarrassing to say that your husband wants to have sex with you but you have no drive, or vice versa. But those are things your doctor can help you with, so don't be embarrassed in front of your doctor. We've heard everything. Seriously. You know, seriously. I doubt that there is anything that anybody in this room could say that I had either not heard before or at least one of my colleagues hadn't told me about. So, but that embarrassment is a real barrier to communication. Going back to the honesty thing, that also goes to when a doctor asks what medications you're taking, and that goes along with your list of questions. You need to know all of your medicines, and that's not just prescribed medications. It's everything you take. It doesn't matter if it's an over-the-counter thing or if it's an herbal remedy. Don't be embarrassed about talking about herbal remedies. If your doctor doesn't like them, he or she will say, oh, I don't think you should take that, and you can choose to ignore that or not. But you need to let them know what you're taking, because if somebody's taking St. John's wort, I'm not going to prescribe Prozac for your depression, because that's going to cause what's called serotonin syndrome, because they're the same types of drugs. You know, you have to share that information, because otherwise your health is going to be harmed. There are actually a lot of websites and things that you can go to if any of you are computer savvy that'll help you with those sorts of guidelines. The National Institute for Aging has some really good things. But the basic thing is schedule the appointment that you need. Take a list of questions or somebody to go with you to make sure you ask all those questions. Write down your answers or have somebody to go with you to listen so that you've got a second pair of ears. Be honest with your doctor about everything. Don't try to impress us. We just want to know the truth. And make your doctor accountable. Make them answer your questions. Ask why. Ask why not. Say, I'm not happy with that. And the one final thing, please, as the doctor's said goodbye, you've said your goodbyes, you've said, I'll come back in 3 months. As the doctor turns to the door, don't say, oh, by the way, okay? Because I will tell you, the doctor, if it's a good doctor, will come back in and sit down and review and go over whatever that was. But that will make that doctor 10 minutes late for the next person. So.
And why is it that you can't have 20-minute?
You can have a 20-minute appointment
If you
well, the way schedules are set up, I shouldn't say you can have a 20-minute. Most are set up at either 10-minute or 15-minute slots. Most doctors these days have 15-minute slots. So it can be a 15-minute or a 30-minute or a 45-minute. Or if it's somebody who does 10-minute slots, it could be a 10 or a 20 or a 30. You can ask for a longer appointment. You have that right. Now, the receptionist may say no, in which case you say, can I leave a message for the nurse? And you leave a message for the doctor's nurse to say, I want to schedule a longer appointment, the receptionist won't let me do it.
That brings up another problem.
Go on.
I've had trouble getting test results back,
Okay.
accurate test results. Chest x-ray, you get a bunk off, you're okay. That's all. That is very annoying. I want to know what the x-ray
How do you do it?
is.
Yeah.
Yeah, and the nurses don't do that. At least the nurse that
Right.
I deal with does not do that. And she might as well be a high school student reading something off a piece of paper. That's all it's worth.
That's a good point. And one of the ways to address that is when you're in the exam room with the doctor and the doctor says, I'm going to send you for a chest x-ray, ask them, how will I get the result? When will I get the result? Who will give me that result? And tell them, I don't want to hear that it's normal. I don't want to hear that it's okay or not okay. I want to know the details.
But isn't true that insurance is dictating a lot what doctor's offices can do?
Insurance has always dictated what doctor's office can do. They have always done it. Your doctor can do any test, any procedure, anything that you as a patient request. And that is, if you want something done, you have the right to have that done. But your insurance company doesn't have to pay for it unless it is medically necessary. So the insurance company isn't so much dictating what your doctor is doing. Your insurance company is trying to make sure that your doctor is doing stuff that's medically appropriate. Now I can tell you, I've been in the US now for 18 and a half years. My first 3 years I was in residency program at Emory because I had to redo my residency when I moved here. So I've been in North Carolina for 15 years in primary care. I have had one request for an MRI denied by an insurance company. And I was thrilled it was denied because the patient didn't need it, but insisted on it. Anything that as a physician I have had a medical reason to order, be it a blood test or anything else, I have not had denied by insurance. The few times where I've had questions on a blood test, I've written the appropriate follow-up and it's been covered by the insurance company. So they're not really dictating it. What they're trying to do is make sure that we do what's medically appropriate and not just do a bunch of unnecessary stuff. My colleagues are going to hate me now, but that's the reality, And it's actually becoming easier to be medically appropriate. There's a group called the US Preventive Task Force Service, which was set up, I believe, under the Reagan administration. And it's a group of physicians who look at what's called evidence-based medicine. So they look at the research worldwide, they look at what tests are valuable, what tests are not valuable, what tests are harmful. And they look at, they just look at the screening stuff, but they'll take one test and really look at all of that data and spend a year or two looking at it and then come out with a recommendation. That's where I don't know whether any of you have partners, male partners, but they may be coming home from the doctor saying, the doctor said I no longer have to have a rectal exam for my prostate, or they don't have to do a PSA test every year. That's because of guidelines coming out of the task force. The most recent guideline that came out is actually screening for lung cancer. So people always think that the preventive task force is about getting rid of tests. The most recent one just came out, screening for lung cancer, because we've not had a good screening test for lung cancer. They are now recommending that anybody, I think it's between 55 and 70, who has a 30-pack year smoking history, which means 1 pack a day for 30 years. So it could be 2 packs a day for 15 or whatever. Irrespective of when they stop smoking, should have a specific type of CT scan of the lung every year. Now, once the US Preventive Task Force recommends something, insurance has to cover it. So, we're trying to do tests that are medically relevant. So if you walk into your doctor's office tomorrow and say, I want that screening test for lung cancer, your insurance has to cover it. Now, if you had said that 2 months ago, your insurance didn't have to cover it because it was not a recommendation. It's complicated.
How about when you get in your mid-80s and past, and they stop doing all tests and don't want to?
Well, the first issue is that you still have a right to have those tests, okay?
Or if the doctor won't see you, like one doctor will send you to the specialist and that you have been going to for years for routine things, and they won't see you.
Well, the question is, are they not seeing you because there's anything that needs to be done for you can be done by your primary care doctor, which is often the case. For example, my mother has been seeing her kidney doctor for every 6 months for probably the last 15 years. And when I spoke to her on Sunday, he said, I don't have to go back for a year. And I said, why not? She has 2 daughters who are doctors, so she said, why not? And he said, because your blood work has been so stable for the last 5 or 6 years, it's a waste of your time. So again, it goes to, why won't you see me? And that's the first thing. The second thing is, very often, and this goes back to that whole power thing I was talking about at the beginning, we think we sometimes know what patients want. So we think, well, why am I making this woman come and see me all this time when I'm really not doing anything for her? Let me make her life easier and just have her follow up with her primary care doctor. Whereas as the patient, that feels like I'm being abandoned and I've aged out of being treated like a human being. Again, ask why not. Because particularly, I hate to diss specialists, and I'm not really, but there is that sense of, I know what's best for you. Now, when it comes to tests, things like colonoscopies, because that's a classic one, because there is a recommendation that over age 80, you have the discussion with your patient about whether to have further colonoscopies. Has everybody had their colonoscopy? Because if not, I'm going to yell at you. Okay, right. I do yell at people who don't get their preventive stuff done. It's much easier to prevent than treat, yes.
I want to ask you a question about the safety of 3D mammography.
I'll get back to that in 1 second, okay? But when it comes to, because I want to address the not doing tests issue, you have the discussion. And the guideline basically says that if somebody has such significant health problems that even if you found, for example, colon cancer at colonoscopy, they could not tolerate the treatment. So say you have terrible heart disease and just basically wouldn't survive an operation to treat colon cancer, then the recommendation is don't do the colonoscopy because you're not going to actually help that person. But the discussion should be had. I have had a number of patients over the age of 70 who've said, no, I don't want a mammogram. It hurts, it's uncomfortable. And my question is always, if you had breast cancer, would you want it treated? And if the woman says yes, then I say, then you need to have your mammogram. If the woman says no, I would not want anything done anyway, I document it in the chart, totally up to you, we move on. It goes down to asking why and why not. Okay? 3D mammography. There's digital mammography, there's standard mammography, and then there's MRIs, CAT scans. 3D mammography, I'm not sure exactly which one you're talking about with it.
I think it's digital.
Digital, okay. Digital mammography is actually pretty much the norm these days. That's what most places do these days. It gives you clearer pictures than the older mammography. If you look at the research, in terms of outcomes, it's probably only significantly better in women under 45 with denser breasts. But we probably see fewer what are called false positives, even in older women with digital mammography, which means we're less likely to think you've got something that needs biopsy. So it's a little more accurate. In terms of radiation exposure, there's no significant difference from standard mammography.
I think most people don't understand the 15-minute appointment concept because my husband would come home countless times. I was only in there 15 minutes.
Right.
He didn't even ask me. I couldn't even talk to him about issues I would talk to him about. And my dad's done the same thing and stuff. So I think most people don't realize that that's an issue.
I think you're probably right, which is why I wanted to bring it up. So, I mean, after a while, I will tell you, if your doctor's office has good front desk people, they get to know who always needs longer. So, you know, sometimes we'll put an alert in the system that this patient always needs a longer appointment, whether they ask for it or not. But, I mean, that really depends on your front desk staff. So, you know, sometimes you're getting a longer appointment without realizing it. But that's because we try to help out. So it doesn't always work, obviously, since your husband doesn't get it. But I've had people who just had a standard flag in the system. They always got 45 minutes because they had a lot of issues, you know, and some people just do. It's not, you know, it's not a criticism. It's just a recognition that some of us have more problems than others, and that sometimes of our life we have more problems than others. So you might be a 45-minute patient for a year and then may not need long appointments, you know, for 10 years after that. Don't be embarrassed about asking for it. The worst they can say is no. And if they say no, what do you say? Why not? Exactly. You know, healthcare is a partnership. It's not a dictatorship. And I know sometimes it's difficult. I know sometimes you feel like it's a dictatorship and you feel like you have nowhere else to go because, let's face it, there's a shortage of primary care doctors. But that's one of the reasons why it is so important to ask questions. You know, if we had 3 times as many primary care doctors as we have, you could send the message by leaving the practice. But a lot of us don't have a choice because there just aren't enough people seeing patients. So that's why it really is so important to ask why and ask why not. And 99% of doctors, and by doctors I really should say providers, because that includes nurse practitioners and physician assistants whom you may see from time to time, 99% of us are not going to be offended if you stop and say why or why not. We may get irritated, but ultimately we'll be grateful because it allows us to give you better care. And if we give you better care, then we're doing our job in a better way, and that gives us better job satisfaction. But don't be afraid to stand up to your doctor, politely. One thing I would say, actually, while I think of it, and I apologize for not mentioning it earlier, I know very often, you know, if you have a question after your visit, you think, I really would like to speak to the doctor about that. That goes back to the system. Honestly, most of the time, you're not going to talk to us. Don't be afraid to leave a message with the nurse, and be honest in that message, because the nurse will talk to the doctor about it. The doctor will give the nurse the response to give you back. That is the one issue with time that none of us has any control over. Most of us work through our lunch, not seeing patients, but reviewing test results or doing things, and we just physically don't have the 20 minutes that we'd like to spend on the phone with a patient sometimes. So,
well, actually, the same person
Yeah.
said if you have, I only said
Yeah.
it once, if you have any problems, if you need a refill, this, that, and the other, email me.
Good. That's actually a good issue. Email.
Yes.
Email is a major point of discussion in healthcare right now. My guess is you go to a Duke practice.
Go to what?
Duke practice?
No, I
No?
don't.
Okay. Just because Duke has used email for a long time
Oh,
with their
okay.
patients. There are still a lot of concerns about privacy with email. And what everybody's trying to work towards is very secure email for health records and things. So you'll find a lot of providers will not email you results because of concerns about privacy and security. That will probably change in the next 5 years as the systems get better at that.
I think that's going to be the least of our problems of privacy.
Yes, I know the NSA seems to know everything else. But the other issue with email, and again, it's a big issue in healthcare literature, is if you have 1 or 2 patients emailing you, it's easy to answer their questions. If you have 30 or 40 emailing you a day, when are you going to answer those emails? Because currently, you cannot charge there's no fee that you can bill for answering an email. And 1 or 2, again, doesn't matter. It's like, the occasional phone call. I mean, if I have a patient whose mammogram shows breast cancer, I'm not going to have my nurse call the patient. I'll call them. You do that. But there's no fee you can charge for any of that. So if you have 40 or 50 emails, that's a couple of hours work each day. And the question is, when do you do that work? And how do you get reimbursed for it? There's going to be a lot of really interesting stuff on that level in the next few years. Which is why it's so important when you're in the doctor's office to make sure you get what you need then.